Hypertension, or the silent killer. Today's video covers a silent but deadly condition affecting millions of people worldwide, which is hypertension, or high blood pressure. Let's explore what it is, symptoms, causes, why it's dangerous, and how you can treat and prevent it. What is hypertension? Hypertension means your blood flows through your arteries with more force than it should. Over time, this constant pressure can damage the heart, brain, kidneys, and blood vessels. A normal blood pressure reading is from 90/60 to 120/80 mmHg. When it rises above 140/90 mmHg and stays there consistently, it's considered high. Causes of hypertension. Hypertension has many causes and risk factors, including high salt intake, lack of exercise, overweight or obesity, smoking and alcohol, chronic stress, family history, aging, underlying diseases like diabetes or kidney disease. Sometimes the exact cause isn't known. This is called primary hypertension. Other times, it results from conditions like thyroid disease or kidney issues, known as secondary hypertension. Symptoms of hypertension. Most people with hypertension show no obvious symptoms. That's why it's called the silent killer. But in some cases, people experience persistent headaches, blurred vision, dizziness, nosebleeds, chest pain, fatigue. These signs often appear when the condition is already severe. That's why regular blood pressure checks are so important. Complications of uncontrolled hypertension. If untreated, hypertension can lead to serious complications: heart failure or heart attack, stroke or brain damage, kidney failure, vision loss or blindness, aneurysm, blood vessel rupture. Managing your blood pressure early can prevent these life-threatening problems. Diagnosis. Blood pressure is measured using a cuff on your arm. The two numbers represent systolic pressure, or the top number, when your heart beats; diastolic pressure, or the bottom number when your heart rests. Normal. Below 120/80 mmHg. Elevated. 120 to 129/80 mmHg. Stage 1. 130 to 139/80 to 89 mmHg. Stage 2. 140 plus 90 mmHg. The diagnosis is made after repeated high readings over time. Treatment modalities. Let's talk about how to treat hypertension effectively. Treatment involves two major approaches: lifestyle changes and medication. A. Lifestyle changes. First-line treatment. Reduce salt intake. Less than 5 grams day. Avoid processed foods. Eat a healthy diet. Fruits, vegetables, whole grains, lean protein. Exercise regularly. At least 30 minutes day, 5 days week. Lose weight. Even a 5 to 10% weight loss reduces blood pressure. Limit alcohol. 1 drink per day. Women. 2 drinks per day. Men. Quit smoking. Smoking damages arteries and raises BP. Stress management. Breathing exercises, meditation or counseling. Avoid excess caffeine.
These changes are safe, natural, and effective, but sometimes they're not enough on their own. B. Medications. When lifestyle alone isn't sufficient, doctors may prescribe one or more of these. 1. Diuretics. Water pills help your body get rid of excess salt and fluid. Example, hydrochlorothiazide. 2. ACE inhibitors relax blood vessels. Example, enalapril, lisinopril. 3. Calcium channel blockers prevent arteries from tightening. Example, amlodipine. 4. Beta blockers, slow your heart rate. Example, atenolol, metoprolol. 5. ARBS angiotensin receptor blockers, similar to ACE inhibitors. Example, losartan. Important, never stop or adjust your medication without a doctor's advice. Medication needs vary depending on age, kidney function, and other health conditions. Prevention strategies. Even if you don't have high blood pressure now, you can prevent it by maintaining a healthy weight, eating fresh, low-salt foods, exercising regularly, monitoring blood pressure at home, getting annual checkups, managing diabetes and cholesterol. Prevention is always easier than treatment. Conclusion and call to action. Hypertension may be silent, but you don't have to be. Get checked. Stay active. Eat smart. Follow your treatment. Thank you for watching. If this video helped you, please subscribe, like, and share the video.